Hi, my name is Karen Vink, and I'm a night CNA here at Hospice of Pella, and I've been here since we opened in 2007.
My name is Rita Hoogheem, and I'm a staff nurse at the Comfort House.
My name is Barb VanGorp, and I'm a nurse at Hospice of Pella. And I've been a nurse with hospice for 14 years to help care for people and families at their homes.
Hospice of Pella is special to me, and I'm passionate about it. All my life I've had a caring way for people, and after my mother passed away, not at hospice, many years ago, I saw the need that people needed to be in a place where families could be with them, and where there were people that knew the end of life care, where hospitals are more for getting people well and on their way. And we provide the comfort and the care in many different ways for the whole person and their families. And it's just a loving place, and we can fulfill the mission here of caring with Christian compassion, and that means a lot to me to be able to do that for our patients if they so desire.
What makes the Comfort House meaningful for me is that we are able to allow people to just be comfortable here. We can do whatever they would like to do that makes them comfortable. We can also work with the families and make them comfortable also. We kind of teach them what's about end-of-life care and the stages that people go through, and I really appreciate being able to do that.
A lot of times we have our own personal stories that draw us into hospice, and mine was I had a sister who was 48, and she had hospice come in the last few months of her life, and I saw the difference that it made for her. She was able to die at home with the help of her family and with hospice, and so that was the birth of my passion for caring for people who are in that last chapter of their life. And it always amazes me when people open the door to us for the first time, because I know what we represent, and it's a difficult thing. It's a difficult time in their life. They've been fighting for their lives, and now they've come up with a new goal. And a lot of times the doctor has said, this is it, or the patient says, this is it. And so if we can help them to feel comfortable, and it's a process, it's a journey that people are going on. One of the things I've learned is that I think I'm probably more of a coach than a nurse, because there's information out there on everything, how to build a deck, how to put a chair together, how to cook a meal, but there's not a lot out there on how to die. And so people, when they hear those words, they think, how am I going to do this? And so part of our job with hospice is to start teaching them. There's a lot that can be done. I say, you're living with whatever your disease is. You're not dying from it exclusively. So what are things that you want to do? And helping them focus on different things than just the physical pieces of their disease. So we talk a lot about relationships and how to say goodbye. And we don't just have the patient, we have the family too, and the friends, and we're teaching them how to say goodbye, how to make that life as good as can be in spite of the circumstances that they're living with.